Good day everyone, I am Ella Marie Pioli from BSed Sciences 3. This video, we will be talking about anisotriasis. What is anisotriasis? Anisotriasis or hearing worm disease is a parasitic disease caused by nematodes worms that attach to the wall of the esophagus, stomach, or intestine. The best way to prevent this disease is to avoid eating raw or undercooked fish or squid. How does one become infected? When a certain infected marine mammals, such as whales or sea lions, defecate into the sea, eggs are released and become infected larvae while in the water. These larvae are ingested by crustaceans, which are then eaten by fish or squid. When humans eat raw or undercooked infected fish or squid, they ingest nematode larvae. Once inside the human body, the larva can invade the gastrointestinal tract. Eventually, the parasite dies and produces an inflamed mass in the esophagus, stomach, or intestine. Some people experience a tingling sensation after or while eating raw or undercooked fish or squid. This is actually the worming moving in the mouth or throat. These people can often extract the worm manually from their mouth or cough up the worm and prevent infection. Also, some people experience vomiting as a symptom, and this can often expel the worm from the body. So, where is anisotriasis found? Anisotriasis is most commonly found in areas where eating raw fish is popular, such as Japan. However, since eating undercooked fish is become more common, there have been cases seen in the United States, Europe, South America, and other areas of the world. Anyone who eats undercooked or raw fish or squid is at risk. Symptoms of anisakis infection. The symptoms of anisakis occur depending on the location of the parasite after ingestion of the parasitized food. There are 3 clinical forms that allow us to know how to detect anisakis when they are affected. First is the gastric form. This gastric form occurs once the anisakis larva enters the digestive tract, and after a few hours, the symptoms of anisakis start causing nausea, vomiting, and severe abdominal pain. Second, intestinal form. This intestinal form, the symptoms of anisakis occur between 48 and 72 hours after consumption of the infected food. The symptoms are similar to those of an acute appendicitis. Patients suffer from nausea, vomiting, acute abdominal pain, and alteration of the intestinal rhythm that can cause diarrhea or constipation. Third, ectopic or extra-gastrointestinal form. The ectopic or extra-gastrointestinal form occurs when the gastric or intestinal wall is perforated by anisakis larva, causing migration to the lung, pancreas, liver, and other vital organs. In these cases, surgery is required. So how it is diagnosed? There are several tests that allow us to know how to detect anisakis and facilitate the diagnosis of the patient. The specialists recommend carrying out studies that include serological, radiological, and ultrasound tests to obtain a complete diagnosis. First, serological tests. Serological tests are used to determine the presence of antibodies to specific antigens. One of the most commonly used skin test is the prick test, which consists of spreading allergic reaction on the skin in order to find what type of substances you are allergic to. Second is the radiological test. Radiological tests allow the discovery of failures in the normal functioning of the organism. Using barium, it is possible to determine the presence of some pathology and confirm, for example, the presence of an edema in the intestinal mucosa.